thank you very much. It's an honor to have you here. Appreciate you spending Sunday morning with us for a little bit of time and giving us some of your time. More and more people are going to start piling in here in the next few minutes, I would say. So typically what we do is, we'll just have a conversation, and there'll be people that might want to ask some questions in the chat, and I'll relay those to you as appropriate. So again, thank you so much for doing this. And I want to, one of the things that I saw, I think it was a tweet from you saying that, you've been practicing for X many years and you really didn't really see a lot of progress when you recommended certain dietary and lifestyle interventions until you switched to a more, I would say, species appropriate, ancestrally appropriate approach. And then you started to see people come off medicines. But if you don't mind, would you briefly tell us, kind of where you're from, what's your background and who you are a little bit, Tony?
Okay, well, let's go back a little bit. I'm a native of Chicago. I grew up on the west side of the city, which is actually, you could argue, one of the tougher parts of town. So I had humble beginnings, and my mom was a single mom, and I had my brother, and basically I was motivated though. So my internal motivation, I think, is what kind of got me to where I am today. And I went to Xavier in Louisiana for where all that good food is in Louisiana. And I actually went there not with enough money. I didn't actually tell my mom the full story. So I got there, half the money was not there, and I was able to kind of find a scholarship that they allowed me to be there. So once I got to Xavier, and Xavier is probably the biggest factory for getting African Americans to both pharmacy school and medical school. So I went there, they gave me a nice foundation, some confidence in who I was. I was a chemistry pre-med major. After doing my training there, I came back home to Chicago Medical School, and I did my training there. And so when I finished my training, I actually did a maternal child health / family practice residency. So unlike yourself, dealing with joints and things like that, I was delivering babies. And I was also taking care of the babies I delivered. So it was mainly it was like a family doctor who was an OB and a pediatrician. I even did C-sections, tubals, all that stuff, because I had this high-risk training, but it was more like acute care. So I didn't have a lot of people with chronic disease. But then I got, you get bored with, spending all your time in a hospital all night delivering babies. So I ended up shifting to Advocate Aurora Healthcare, where I work now. It's in Illinois and Wisconsin. And in that model is older patients, like I'm an internist. And so I follow those HEDIS measures. And, for those who are not aware, that's I think it's healthcare effectiveness data set or something like that. But I saw that you had talked to Dr. Christine Bear, and she talked a little bit about how we have to follow these measures. And if we do a good job with disease management, we're considered good doctors, right? So I was doing a good job. I felt like I was a great doctor, but people weren't getting better, right? Just like that tweet. And I had irritable bowel. That wasn't going away. Wife was dealing with diabetes and didn't want to take medicine. So I had to start thinking outside the box. And when I started doing that, that led to research. And I just realized that, wait a minute, this vegetarian thing is not beating the Atkins in these studies. And it just kind of blew my mind, because I was a vegetarian for about 8 years or so. And so I said, let's do an experiment. Let me try this on myself first, which I did. And then after doing it on myself, I started doing it on family and patients. And lo and behold, I spent like 17 years not taking people off medicines hardly ever. And just these past 2 weeks, I've taken probably about 8 people off medicines in 2 weeks. And I literally went 17 years taking a couple of people off medicines, and they were like ultra athletes and did things like that. So that then led to more knowledge. So I wrote a book, Fix Your Diet, Fix Your Diabetes, because I wanted to take that knowledge and put it on paper for my patients, and kind of a workaround so that they would have that information. Then I did the board certification in obesity medicine. I think Dr. Bear also did that. Dr. Andy Fung, who I follow, I don't know if you've ever talked to him, but he's awesome in North Carolina. I just interviewed him for my podcast. And so now I'm in this large health system trying to navigate. But fortunately, I have a leadership role. I'm actually a medical director, and we're working on a weight management program. So what I'm trying to do is like, how do I take that model, unlike Dr. Andy Fung, unlike Dr. Bear, I'm not in, or even Dr., I know you've interviewed Dr. Ken Berry, I'm not in private practice. So I have to be very cautious about making sure I have some science that firmly supports this model, because, and that's why I was happy to say, I just literally just realized you were trying to do some research yourself. And I think in order to get a health system to change, you have to really have as much science as possible, while recognizing that you're not going to have all the science possible with nutrition, right? So what I'm trying to do is like juggle, and even you have been kind of a motivation for me. So I've kind of gone from my omnivore status has shifted from animal plus a couple of sides to animal maybe one side, and now, and I may do the same experiment you did where I, you know, kind of try it out. I'm really at the point where most of what I eat is animal, and then I'm doing a little vegetable now, but nothing has really helped my patients like this lifestyle. It's just, and all I'm trying to ask my colleagues to do is to think outside the box so that they can see the benefits. And I think we're just not able, people are just not able to do that because they are required to follow these guidelines, and these guidelines get us in trouble because they don't really let you think. It just forces you to follow. And so if I can, and the thing is, even if we have this empiric data that says, I mean, I'm taking hundreds of people off medicine, and what I'm saying to my colleagues, and if you're a clinical person listening, if what you're doing is not working, be willing to at least think outside the box. I don't blame them. The dietary guidelines, we have to follow, the hospitals have to follow it, the American Medical Association, the insurers have to follow it. So it's really, these guidelines are what's getting us in trouble. So it's not those people, even the, like I said, even the insurers, it's these metrics they give us that say it's better, but yet nobody's getting better. So that's kind of where I'm at now. I'm trying to like navigate the health system, leadership, social media, podcasts, YouTube videos, and I've been a little bit more active. Dr. Kim Berry hit me upside my head and said, you need to start making content so that people can hear this stuff. And I certainly don't see a lot of people of color. I'm actually going to be, part of what I'm going to do moving forward is I'm trying to find people of color as well in this space, because they need to have a voice too. And I want to be kind of part of the team that gets them out, because the people I serve is 95% African American. And if anything, they need the information more than anybody. I mean, they just need this information and they're just not getting it, and they're afraid and they don't trust the health system. And so maybe if they see a face that they can be more comfortable with, you know, then maybe that'll help. So that's kind of where I'm at. It's a long answer to a short question, but I just wanted to frame it around those thoughts.
Yeah, Tony, there's a lot in there, and there's so many great points we can follow. But first of all, I'd like to say I grew up in Chicago too, but I was on the South Side. I was near Chicago Heights, and so
cool.
My grandfather was a Golden Gloves boxing champion of I think the Greater Chicago area, and he fought against when Joe Louis fought Max Schmeling back in the I guess it was 1930s. My grandpa was on the undercard, so I'm familiar with that area of Chicago. So I know it, and certain areas are definitely tougher than others. But the one thing you said, well, there's so many things you said in there. I think I wonder if we should expand on all of them if we get the time. But one of the things you said is, you know, I'm a good doctor because I hit these metrics, and the follow on to that was, but my patients weren't actually getting better.
Right.
I think that is a fundamental problem with this. You know, and I've likened to calling it disease maintenance or disease management system, because really what we're doing is managing disease, and we're not getting people out of that. They're not coming to us to get healthy. They're coming to us to have their pills shuffled around more. Yeah. It is very frustrating. The thing you said, and I was a medical director, I was the head of the orthopedic surgery group, and I can tell you, I feel your pain, because it is very, very hard to do the lifestyle things. You know, I was in a field where, you know, all they cared about was how many surgeries I did.
That's right.
I mean, that's the bottom line. I mean, medicine is a business. We've seen the administrative side of medicine grow exponentially, while the actual surgeons, you know, the grunts on the ground getting it done, we haven't really increased much. And actually we've given away so much power as physicians in general to this administrative, which is completely motivated by business costs. So it's very, very tough what you're doing. And I really, I mean, you know, the African-American people of color thing is so important, because I do think, you know, people are going to identify with who they identify. I mean, I know certain people are going to identify with me because who I am. Right. And it's so important to get this message out there because, as you know, disproportionately, African Americans suffer more from chronic disease, higher rates of diabetes, higher rates of obesity, higher rates of cardiovascular disease.
Everything.
So you know, it's like, you know, there, and now obviously there's a lot of things going on, whether it's socioeconomic, whether there's some, maybe there's some, you know, individual genetic things that go in there. But regardless, and I do get that, you know, you've got, you know, in historically things like the Tuskegee craziness where,
That's right.
you know, the community is like, hey man, these crazy people gave us all syphilis,
Right.
let us die. I mean, I understand it. And quite honestly, as we watch, you know, I don't want to get too controversial, but as we watch things unfold currently, more, I think people in general of all colors become more and more mistrustful of our you know, systems, of the FDA, the CDC, the USDA, because we're just seeing more and more, it looks like it's profit motive and not necessarily health motive. We're the little guys fighting against this big system. So I appreciate anybody who does that. So I guess what I'd like to do is ask, you know, since you started adopting, and this is the other thing, I didn't change the way I practice until I changed, I did to myself. And I think most physicians have to go through this epiphany where they're like, you know, oh my gosh, this works. You got to test it out on yourself. And then you're like, wait a minute. Okay, now can I do it to my patients? So tell me a little bit about a little more about what made you decide, hey, you know, because, you know, it seems like, you know, you got to get to a certain age because when you're in your 20s, everything works.
Everything's okay. You kind of,
start getting 30s, 40s, and all of a sudden it's like, wait a minute, I don't feel so good. And I'm a doctor and I'm supposed to know how to fix myself, right? So walk me a little bit more through your personal journey into changing your own diet, and then we can talk about specifics with your patients.
Yeah, and actually, when so I've always been a healthy guy. I've never been like the standard American diet guy. So that's why I did the vegetarian thing for about 8 years. You know, Dr. Ornish and the rest of them, Esselstyn, and I did feel better. I mean, when you go from a standard American diet to anything that is more whole foods based, you will do fine. So, and I did feel better. However, I don't know that I knew this. Just like, so if I haven't done carnivore yet, right? I don't even know how much better I feel. I feel phenomenal right now, right? But how much better, you know, I remember I wear contacts. So when I put glasses on for the first time, I was like, whoa, it was brighter, it was clear, but I had no clue because I had never worn glasses, right? And so during my vegetarian days, I felt better. I did have to eat often, but I was oblivious to that. I did find that I had problems with gas. So I always told my patients, and I was known as this vegetarian guy, well, just do Beano, you know, and then some people it worked, some it wouldn't. But it just, to me, I was just focused on, I needed those phytonutrients because that's what I was being taught by these experts. The thing I made a mistake with until I started authoring, you know, writing a book and making that change, I never compared that to something else, right? And then, so that's what happened. But from a more personal perspective, two things happened. One was my hands. So I talked to my mom about this because one day I was knocking on the door to the patient's room and I was like, my hands kind of ache a little bit. Didn't think much of it, but it kept happening. It got to the point where I had to use my pen to knock on the door. And I was like, oh my God. So I knew as a physician, I did the standard lab panel. Of course, it was all normal, and it usually is in the beginning. And so I was like, okay, so I don't have rheumatoid yet, but something's going on. And I found out that there were a few people in the family with arthritis. So that was the first thing. But during my vegetarian phase, it really didn't seem to affect it in a great way. And then the other issue was irritable bowel. And I've had irritable bowel forever, up until, and it got better with probiotics. I'll be honest, that helped a tremendous, but when I would stop the probiotics, it would come right back within a month or two. So, and then, and it was a little better with the vegetarian diet, but however, so when I transitioned to this whole low carb, high fat, essentially keto, I tend to get about 20 carbs in a day, maybe 30 if I'm cheating on some kombucha or something like that. Because sometimes I actually was doing kombucha because I was trying to get the GI benefit with the probiotics based on that way of thinking. So ultimately, when I switched to keto and got it down a little bit, what would happen is now I'm knocking on the door and it's not bothering me. And it was just weird, you know, and I sometimes by habit, I'll still pull a pen out, you know, because I'm kind of used to it. But like I'll go through the entire day and I don't feel my hands at all. And that was just weird because it was one of those things that you would just feel. And then the irritable bowel essentially doesn't exist anymore. Like it's just gone. But there are times when I'm nervous about something. And if I'm about to make a presentation or something, you can kind of hear it. You know, your stomach rumbles a little bit, but it's nothing like what it was previously. So right now, I'm in a pretty good space, mental clarity, which was a huge issue. Many days I would go to the traffic light and trying to be the great doctor. I'm sure as a surgeon, you were like early in the hospital, you just, you know, you compromise your sleep. I literally fell asleep at the light like at least once or twice a week. And it was so dangerous, right? So those days just don't exist anymore. Like I feel mentally clear almost all the time. So I don't know how it has affected my performance as a physician, but but I just feel like I've crossed the 50 mark and I feel like I have more energy. I'm in a building with 130 people and I know I can outdo any of them. I just feel better than the 20 and a 30-year-old that comes in saying they're tired on a Monday morning. You know what I mean? It's like, it's Monday, you're just getting started and you're tired. So for me personally, it's one of those things that you can't imagine would be better. And that's why I'm kind of curious. And my curiosity about what you, Dr. Canberry, are doing and others in this community is I may do the same experiment at some point. However, I don't want to be I don't want to get it. There may be some vegetarian guy on Twitter that's doing phenomenal, that's got the same body you got, you know? So I want to be a little bit more, take your time, think it through. People are paying attention to what you're doing. And that way, and what I think what's going to happen in my practice, there will be that, you know, that bio-individuality concept. You know, I'm going to look at people in front of me and I know if they have autoimmune disease and things like that, they'll probably, you know, Carnivore will kill that for sure. And that'll be great. But I'm going to look at the individuals. I'm going to say low carb for everybody, whether they're vegetarian or carnivore. And then but what's happened and what you've done, and I appreciate all of you guys, is that now I have permission to look at something I hadn't even thought about. And that's huge and I think that's why this community is important, because you want to give people an opportunity to say it's okay. It's okay to not eat breakfast after years of being told that's the most important meal of the day. I rarely eat breakfast, but somebody had to give me permission to do that. And once I got permission and felt great, I was like, okay, good. But, you know, and now, by the way, I just want you to know this, I'm in the University of Western States. And I heard you comment once about, you know, how some functional medicine docs are not really being docs. They're basically just ordering tests, right? And I think that the problem with, like, the overarching approach, I think, is important. Root cause of disease. That's like my podcast is all about root cause. However, if you're not being a clinician and doing your evaluation, and what are you doing ordering to, you know, all these tests? You're not even you might as well just let anybody else do it. Anybody can order a test, but you should be able to figure out where should I focus my energy. And what I'm doing, as I hear what they're saying, and they seem to be leaning more vegetarian. So it's very interesting. I feel like I'm in the lion's den, you know, but it's great because I'm getting their perspective. And then I can argue with my instructor. I just shared that College of Cardiology fat's okay thing. And you know, and they still push back, but I'm like, listen, we're going to argue about this because my patients are healing. And I can't go back to that old way of thinking, but I'm going to also listen to them because I don't want to be so indoctrinated into this keto world that I'm not listening to, because there may be something down the road that maybe there are phytonutrients that we can only get from plants. I don't know, but I just know that I feel great. So.
Yeah, and again, another great point, several great points. One of the things that, when you point out about the lifestyle medicine, the American College of Lifestyle Medicine was basically founded by vegetarian vegan groups. So they kind of, they've kind of got early on board with running the functional medicine stuff. And I do have that, when you see many functional medicines, just their intake is like, here, order $2,000 worth of labs before I'll even see it. I think that's a disservice to so many people because they may otherwise have a better approach where it's more based on root cause, but to ask somebody to order all these labs and half of them they don't even need without even examining somebody.
It's also, you could argue is, I'm not saying it's racist, but how many people of color are you going to be able to help? I mean, it's like, who can afford that? So please be a clinician and identify areas that are important to that particular group or person. And there may be only 3 tests you need to order. I mean, it doesn't have to be this insane. I just think that it's a cop-out to order all those tests without having evaluated a person.
Yeah, I agree 100%. Now, the other, well, guys, there's so many good things you said in there. I wanted to, this is, and again, I guess when you say, because you're 95% of your population African Americans, do you find more acceptance to lifestyle treatments versus medicine in that community? Or do you feel that because I know a lot of us, it's like, only a certain number of people's ears are open. Only a certain number of people want to hear that message. Right, some have been trained to, hey doc, something hurts, give me a pill. And that's kind of, like patients have been trained to do that over decades. Right. And so are you finding that maybe they're more willing to say, hey, maybe I don't need to be on this expensive medication or have this surgery, and maybe I can heal it with just regular, common sense stuff?
Yeah, it's partly what I said earlier. It's about the trust. So if I can and by the way, let's be clear, some of my best doctors are not African American, doing a phenomenal job with African American patients, but the patients trust them. So the first piece is, let's build rapport, right? And then when you get racial about it, the racial piece is, they're not going to do it. They're not going to do it. I mean, I'm not saying they're just lazy. I'm just saying our perception is that people won't change. And I know I've already done my empiric study, which says, yes, they will. They may not want to graze and eat grass all day and do this whole, vegan thing, but they will. If they can still eat their rib without the barbecue sauce, they'll do that. So the other part is this idea of, some of it, when there's a barrier, sometimes it's cultural because you don't want to have to eat, white people food, right? So if you can stay culturally, in a similar place where they're comfortable, then they will be more willing to do that. They just don't want to get caught up in this ideal of, I have to do what the dominant culture's diet is, because, but if you think about soul food, greens and cabbage and black eyed peas. I mean, if you go into the vegetable part, there's nothing wrong with that. They eat plenty of meat, which obviously is not a problem. I just have to train them about barbecue sauce and flour and cornmeal. And yes, if you make a salmon croquette and you don't put cornmeal on it, it's still going to have a crust. I don't know if you guys have Wingstop, but Wingstop, the fried wing joint, they don't use flour. Who'd have thought? And it's like the average person wouldn't even know that. And guess what? It still has a crust. So your brain tells you it has to have the flour for the crust, but the reality is, no, it doesn't. So what I do is I say, you can still do your wings. I may tell them to use a different kind of oil instead of those highly processed oils, but you can still do those things. And then so what I do is I see where they are, and then I ease them towards it, depending on where they are. If they're metabolically just destroyed and they're, on the verge of kidney issues, we go more aggressive. But if they're just, I'll say, okay, I do the motivational interviewing. So I'll say, what is it that you are willing to do? I also say, if you're at a 4, how do we get you to a 5 out of 10, or a 6 out of 10? And then a lot of times you're asking them to call the relative or wife or husband who's maybe not on board, and we'll have conversations like that. And what I want clinicians to understand is that if you don't take a moment to help them in these areas, then you're not really helping them. if your only thing is to meet your HEDIS goals, and you've given them their referral to the ophthalmologist, and you've given them their statin, and you've given them their metformin, but yet they keep coming back with the same problem, then why are you wasting all that time doing those things when you could have just took 10 minutes out of the 20 minutes and talked about this lifestyle? The bigger issue is, do they even know what to tell them? And that's part of the problem, is that the docs, I mean, when I talked to Andy Fong, Dr. Andy Fong about it, he just got his board certification, and he's on Twitter for those, Dr. Andy Fong. Are you familiar with him?
Yeah, and I've talked to him. Yeah, it's Phung. In fact, I should get him on here to chat with him.
Definitely talk to him. But he definitely is, you gotta get the training. And so he said that, we may be up to, I don't know, 3,500, 3,600 docs with board certification. And again, that's not the golden everything. I'm just saying, I learned a ton in that setting. And I learned a ton, and it's like it adds. And I'm going to learn with the University of Western States, even though I don't agree with everything they're saying. I'm going to learn some biochemistry. I can talk about oxidative phosphorylation or whatever, because that stuff was 100 years ago for us, So it's like, it's nice to be able to have an intelligent conversation, and that's why I'm taking the time to do that. And so anyway, I am very much thinking that for African Americans, we need to build rapport. We need to believe that they will do these things. And then we need to coach them along the way. Everybody just needs a coach. Serena and Tiger Woods are not the only ones that need a coach. Kobe Bryant wasn't the only one. As great as he was, he needed a coach. And we all need to be coached to optimize our ability to get to our ideal state. And then we inspire each other.
Yeah, that's one of the, it's part of this platform. We have 100 plus coaches here. We've got coaching all the time. So that's one of the things we do here, which is nice.
Love it. Love it.
I would like to comment, when you describe white people food, I don't like white people food. If it's the organic fruits and vegetables.
Right, yeah.
I don't eat that crap. But I mean, I got to tell you, one of the things you brought up is, and I agree with you 100%. Not everybody's going to need to go on a full carnivorous diet to fix their problems, particularly when it's like diabetes and these kind of standard cardiometabolic issues, obesity. Now, in my view, it is extremely, extremely powerful. It's a hugely powerful tool, a powerful weapon. And when you look at like inflammatory diseases, when you look at gut-related diseases, when you look at autoimmune diseases, wow, this is where it really, really shines. And by the way, yes, you can get your diabetics from, a hemoglobin A1C of 10 down to 4.5. I mean, that's super powerful. Let me ask you, so now, you're still in this sort of traditional allopathic, system where, you gotta, if you're working for somebody, you gotta see X amount of patients.
That's right.
Every 15, 10 minutes, whatever the deal is, you gotta hit certain metrics. How do you, obviously if you've got your YouTube videos, when I was doing this stuff, I was handing out flyers. I was saying, go read this book, watch this video. How do you deal with the time constraints as a sort of a traditional doc and trying to get this message out?
Well, definitely what you said is true. So we have Epic. Epic is our medical record. And in Epic, you can create, dot phrases or smart phrases. And what I do is I have buttons. So when I go to my wrap up summary, I just click button, keto this, low carb this, Boca, butter, olive oil, coconut oil, I just click buttons and all of these things just bloop on their chart. So that's number one. Number two, I give them a handout which has all of the eat this, don't eat that kind of stuff. Number three, I recently started a video. So I have why adopt a low carb diet, how to adopt a low. So if anybody's listening, just go to YouTube and check those out. The podcast, that'll be the Protecting Your Nest podcast. It's like, okay, now we have a coach that will virtually be there for you. So I do an interview and then I do a post interview for those who have the courage to go to Facebook Live. So they have almost 2 hours of content every week. So that's what I do right now, but I have a little secret device by Scribble. It's a company called IKS. And I have beautiful doctors in another country, India, who write my notes for me. And every time I think about it, I just get emotional. So when I walk in a room, I talk and my notes are recorded and somebody else writes them for me. Now, of course, I know that won't be available for everybody. If you're a clinician and need that type of resource, I would ask your organization to look for it. So what used to be a 15-minute visit, I do 15 and 30 minutes. I would spend 18 minutes and 15 minutes. Over time, you'd be running behind. That's what, when they did a study on me, it got down to 12 minutes. So, and then what happens is, not only can I teach because I can just literally just talk and get it to them while using those resources, but I also it changes how I interact. I can go to Miss, Smith and touch her shoulder and walk around and just be present instead of just focus on this all day, just typing, just literally some doctors, you walk in a room and they're just like, first of all, the computer's facing away from the patient. So they're like, their backs to the patient. It's just a ridiculous model. So now the data is collected on behalf. And so that's a great gift. And the irony is that the philosophy of a lot of docs is that, because it's a cost sharing program. So a lot of docs are like, I'm not paying for that. The organization should pay for that. But what I'm saying to any clinician who's offered these things, you're like, I think I paid for it in a couple of months in terms of what over and above my, and so what happens is now I can go home and be present for my family. I can treat my peers and as a medical director, I'm not, kind of angry and upset. And, besides all the keto and fasting stuff that benefits your mind, I just don't, I go to work and see 25 to 30 people on the schedule and it doesn't like scare me. So, and even taking a moment to do what we're doing today, it doesn't, I used to spend Saturday and Sunday, the entire day catching up on work. Now it's like I have time to make videos and do things like a podcast interview. So what's happened is that I got my life back. And actually, if it wasn't for that technology, I'm not sure the things that you see me doing, I would be doing right now, because I would just be overwhelmed. And think about it, I'm in school. I have 2 classes I'm in right now. I had a quiz I had to take yesterday. Actually, ironically, guess what they talked about for the quiz? Amino acids, right? So I had a chance to review some amino acids and how they're beneficial. So that's kind of my workaround. And I know it's kind of unfair to bring up a technology like that because everybody won't have access to it. But so work-life balance is critical, not only for the patient, but obviously for the doc and their family and their team members. I'm nicer to my medical assistant because I feel better. So I think any doc that's in this space or AP, advanced practice nurse or physician's assistant, you have to think of efficiencies. But the main message today is, if you just wait for your nutrition professional they may or may not even go see that person. They may or may not be competent in this way and it's more likely that they won't be, right? Like one of the tweets I did earlier today was another, I was sharing the Diet Doctor's website that you can find low carb people. And then the person who reacted to the tweet said, by the way, I'm a dietitian. We're on the site too. I didn't even know that, to be honest. But so there are people out there who are not interested in balance and interested in what's benefiting the individual. But it's not that often you find people like that. So we have a lot of work to do to get this message out so that clinicians will be guided by something other than this traditional approach. And so it's just going to be interesting to see how things evolve, because even as we collect data, the powers that be, are they going to hear it? Is it going to be 10 years from now? Is it going to be 2 years from now? But it seems like the tide's changing a little bit with the American ADA, saying low carbs, okay, obviously with the College of Cardiology. So there's hope, but we need to, people are dying. And my biggest problem is there are people who are dying for lack of knowledge. So I can't wait for my uncle who's 65 and, diabetic, hypertensive. I can't wait till he's dead to, give him an option that's going to save his life. And these things turn around overnight. I mean, Dr. Andy Fong told the story of a person who had dementia who had to be brought in with a couple of people. And literally a few appointments later, he was driving himself to the clinic. Who'd have thought that something like dementia could get better with this methodology? So I just think that I want this person with dementia to be here longer and be present if possible. And now that we have solutions, we can't keep waiting for the powers to be. to finally, either through bias or just waking up, to change the recommendations that they're giving us.
Yeah, I agree. I mean, I think it's going to take more than just waiting for the sort of large medical governing bodies or organizations to come with their recommendations.
Right.
And I think, I can't remember the name of the gal, maybe somebody, I think her name's Simpson, who's the head of the ADA, who herself is a diabetic,
Right.
who adopted a ketogenic diet. And that's probably the only reason, I would say that's a huge reason as to why that is now part of the guidelines, because you have somebody that's personally affected. And all of us in this room and our audience have been, have been either let down by the traditional advice and have kind of found our own route. And I have the fortune to spend every single day with these people, 365 days a year, getting feedback, asking them questions, seeing what's working, what's not working. So it's a really nice way to gather knowledge and also disseminate knowledge. And so, I mean, I think there's a lot of routes that we have to pursue this. And so I wonder, this is a question, because, you're handing out a sheet to somebody presumably, and it says, eat butter and coconut oil and olive oil, all this fat. And the knee-jerk reaction is always, oh my God, I'm going to have a heart attack. My cholesterol is going to go up. So how do you navigate those sort of questions, and what are you seeing clinically? Because I mean, I do agree that we will see rise in cholesterol in a certain subset.
Right, that's right.
Does it ultimately end in cardiovascular disease? So how do you navigate that?
I think because so many of these patients don't trust a lot of things they hear anyway, that rapport matters. So that's part of it. The other part is that you tell them, well, my numbers are fine. I think, I'm one of those weird people who, when I can't remember my numbers just off the top of my head, but because I don't really I'm kind of like you, I don't really care too much anymore, but I did care a little bit because, I just have to know a little bit about it. And so my cholesterol probably never's over 150 total, if you're just looking at that and you think it matters, right? So sometimes I'll even show them my numbers and say, hey, this is how I eat, and you know what, I'm doing fine. Part of why I like you being kind of the face of some of this is because of what your body looks like. So, and what probably inspires me a little bit to consider this is because you and Dr. Kim Berry got a body that people can look at, as a guy in particular. Yeah, I see you, Charlotte. But it matters to me to, look a certain way, feel a certain way. So part of my goal is when I walk in a building and I'm giving advice, I need to look the way people would want to look, right? So I'm very conscious of that. And so I think that if you add, what you're saying about your numbers, how you appear, the fact that they trust you and have rapport with you, when you put them all together, they're willing to try. But I also, I tell stories. I also, give them, additional examples. And what I do is I help them to see the numbers. So I do have some information. Say, check this out. Look at this tweet. Look at this person's kidneys, right? And I had a guy who, I tweeted this a while ago, but his creatinine was, he basically had a dialysis catheter in his arm. I mean, he was at that point, he was fairly new to me. I said, let's do it anyway. But his creatinine, and he's still kind of like on hold for dialysis, but his creatinine, which is a measure of his kidney function, for those who don't know, it went, I think it was at 7 point something. We got it down to 3 point something. It's like the last time I checked, it was 3.2. So at 3.2, you don't do dialysis. So so I think what I tell people, and Dr. Jason Fong would say this, you want to get people a little earlier than that. So if you can get somebody when they're at a 2 or a 3 creatinine, I've seen a ton of patients, numbers just go to normal. So if I got a patient in front of me, I look at their situation, what their concern is. If they're a diabetic, I'll say, look at this patient. This is what they're doing. They went from a 12 to a 4. Look at this patient. Their creatinine's a 3. Yours is a 2.5. Look at their creatinine now. It's like a 1.2. So what I do is I have enough data points for them to see that. And when they see that, and then I scare them. I say, you know what? I say, if you're on dialysis, your mortality rate in I don't know if it was 2 or 5 years, but it's the same as a hip fracture. It's the same as cancer. So, but people don't think about that because they say, well, my uncle's been on dialysis for 10 years. I say, yeah, he's an outlier. Like most people on dialysis are not on it for 15, 20 years. they have complications. And what I'm saying to this 50-year-old who has, you know, a job or two, you can't have a job or two if you're spending, you know, 5 to 6 hours worried about dialysis. So if you tell stories and you keep it real, and you're not afraid to be honest about this stuff, and not afraid to speak the truth without, you know, while giving them hope and saying, this is the easiest thing you can do. Stop eating breakfast and stop eating carbs. And if you do those two things, you will literally start to heal. And most people will hear, and then I speak with a little passion. But what I don't do anymore is that I'm not as preachy as I used to be. I literally would leave the day just upset that people weren't changing. What I found is that that wasn't good for me or them. So what I do is I help those who are ready to be helped, and I wait for those until they're ready to be helped to come to me for help. So if somebody comes to me at 50 and they're now in dialysis after I haven't preached to them 5 years ago, I'm like, well, we'll start. I don't demonize them. I just say, I understand you weren't ready, but are you ready to now make some changes so that when you get a new kidney, you'll have a body that can receive that kidney better. So that's kind of my angle. I understand that most people are sick because of what we've told them. I was the one telling them to eat oatmeal every morning in the past. So I had to, you know, grow past that and then give them new information that'll get them to a better place. But I'm just as responsible as the ADA and everybody else that was given the wrong information.
Yeah, and we're all guilty of that. I mean, I used to totally dismiss patients who would come in and they would say that, you know, they would feel that eating certain foods would lead to knee pain. I said, that's ridiculous. Get it. You're kind of, I mean, that was my thinking. I'm like,
that's right.
You know, and I didn't get any training on that. I had no better. And then it kind of, you know, then I started seeing happen. And then, you know, like when you talked about at the beginning, it's like when you put glasses on, you can see. It was like, for me, it was like you were seeing in black and white, and now you can see in color. You see the world in color, and everything opens up. And once that happens, you can never go back.
Can't go back.
Can't go back. Once you've seen it, you can't unsee it. And so it's kind of it's really challenging to not say something, particularly when you have something, you know, like if you have a diabetic that's poorly controlled, you're like, this is an easy problem to fix. That's right. If you just do what it takes. And I think,
but it's too obvious. Don't you? I mean, and I've said this elsewhere, but don't you feel like you're in a matrix? I mean, I never felt like I was the smartest guy in the room, but yet to me, a diabetic, a person who's obese, carbs, grains, sugar turn into fat storage. To me, that should be an easy concept to understand. So I feel like I'm in a matrix because I'm seeing things with clarity. Things are moving slow motion for me. All of these brilliant clinicians, scientists are still saying a 40 carb grain is the way to start the day if you're diabetic. So the disconnect kind of blows my mind. And I just can't seem to put that together. I just know I'm not the smartest guy in the room. You know, I have to read stuff 5 times to get it. And yet this is so obvious to me. And I just want to say that out loud because I just want people to say, if you're a dietitian and you only have a very small percentage of your clients getting better, you need to question that. Or if you're personally struggling with your weight and you're a dietitian, which is very true in a lot of these health systems, you have to question your own advice. Why am I struggling with my weight? And I'm the expert in the nutrition field. So we have to be more skeptical. You know, when things are not going right, we should question those things. But yeah, I just want to say that it perplexes me that what should be obvious, carbs make your sugar go up, so we should reduce carbs. You know, what organization would recommend half your diet is carbs? It doesn't make any logical sense when you're a diabetic or you're trying to lose weight. So.
Yeah, you know, unless you're skeptical and conspiratorial and you think there's some conflict of interest in there, which there very well seems to be. You know, and clearly, like I said, you know, here's a wonderful example. I read a paper from 1920. I know it's going back a ways, and people say, "Oh, that's 100 years old. Who cares about that?" But this is right before insulin is invented, and they have 73 patients admitted to a hospital. These are all patients basically in DKA, patients that are like almost on their deathbeds. These people have lost all this weight. They've fallen. Like what an untreated type 1 will do is they'll just wither away. And these people are weighing 75 pounds, 80 pounds, almost dead with uncontrolled, you know, glucose in their urine, dysglycosuria, and they put them on a diet it was completely devoid of carbohydrate. It was basically 90% fat, 10% protein, and within days, normal blood sugars. And these people and they were maintaining this for many years afterwards, and they weren't dying. And this is without even, these are type 1s without using insulin. I know that's really controversial to say that, but this is what worked. This is the most, and I know you wrote a book on that, but I think in my view, the fastest way to get someone's blood sugar to normal is to do, go on a certainly a carb-free diet, probably leaning more towards fat, and then, and then you can add exercise and, start with a caloric restriction, then move it up. But I mean, it's just like, we know how to fix this. This is already there.
Yeah, well, Dr. Bernstein, I mean, he's a type 1 diabetic, and his book, I mean, I didn't read his book, cover to cover, but he's a type 1 diabetic, and he's like 80 something and doing just fine. So, and I remember a time when the type 1 diabetics did not have that type of longevity. So I think that you're right. These data points have already been proven. And any graph that shows what fat does to your glucose and your insulin makes it very clear that fat's probably your friend. And now that we have enough science to not be afraid of fat, we should now have enough courage to say we need to encourage our patients to eat fatty diets. And the reality is there's 50-year studies. Maybe we can't wait 50 years to get those studies. And I like what you're doing. You're going to start the process, but the key is, if you do something that gives those like literally miracle results, and you're not willing to open your eyes to that, while recognizing that there's no like 100-year study out there, it would be irresponsible to me to not at least offer that to patients, or at least educate yourself about that. And that's kind of why I'm a chronic learner and don't mind being in the master's program, because I want to keep filling those gaps of knowledge and just be open to changing my course if I need to. I just want to be deliberate as I turn the ship in a different direction.
Yeah, I think one of the biggest frustrations I have, with nutrition and somewhat to healthcare in general is, we have, well, and this is a bit, we have, it's political season, and everybody's talking about how we're going to fund the healthcare system and who's the Democrats or Republicans, back and forth. And I'm like, what are you even funding? You're funding a system that's fundamentally failing the general population. Let's figure out how to fix it rather than how to fund it, because we're funding the wrong thing. But beyond that, where people are saying, well, if you eat a high-fat diet, your risk for cardiovascular disease in 30 or 40 years, it may kill you 3 years early. I mean, honestly, the answer to that is, even if that's true, I've got a patient who's sick in front of me right now today.
Right.
Let's focus on getting these people healthy today.
That's right.
Get rid of the disease today, and then you can worry about if they live to 90 or not. But I mean, we don't even take care of getting the sick people healthy.
Well, we're horrible at it. We're great at surgery. So orthopedic, if I have a broken limb, I'm coming to see you. I think we do great with those things. But I agree that we need to help people. And then when you do this type of approach, you mean to tell me that you're sleeping better? You mean to tell me that you have so much energy that you can now exercise? You mean to tell me and that's partly because they lost weight. You mean to tell me that you are able to be more emotionally in a good place, so that, because when Dr. Ken Berry talks about how he's a nicer guy, he's a tough guy already. So he's a nicer tough guy in terms of how he lives his life. If I can do something that you're literally saving marriages. One thing I learned when I was doing some research on hypoglycemia, I learned that one thing that was bad about that was that you can increase your risk for dementia every time you have a low blood sugar, which was really crazy. But the thing that was the most interesting was that when people have volatile sugars, which you do not have eating carnivore, which you do not have eating a high-fat diet, their relationships are dysfunctional, because they literally are just always irritable. They're always, just not in a good place, always just not feeling good. So it messes how they interact with the kids, how they interact with their spouses, how they interact at work. And literally, so you're not just saving their body, you're saving the community that they're connected to, so that when they go to church or when they go to work, they actually can be a decent human being that's not, feeling horrible. So these are some I would trade that any day. But the thing is, the quality of your life gets so much better that if it were true, in theory, that in 30 years, something bad will happen, I would take that any day over feeling horrible for the next 30 years and then having the same outcome. So I just think that anecdotal evidence, we will have to do some of that until we get more studies, but I think we do both. And we rely on, Verta, we rely on Diet Doctor, we rely on what you're trying to do. We rely on some anecdotal stuff that people like myself and Dr. Barry and Dr. Fong and those folk do, but we'll do both. But what I'm not, if I'm in a health system and they have an obesity management program, I'm going to be on that committee. And I'm going to nudge them towards a model that does not demonize the diet that seems to be helping the most people. Luckily for us in Advocate Aurora, we have multiple members of that committee who are board certified obesity medicine, what I'm trying to do with them is let's do metabolic health as well. So if we do metabolic health, that's not as intimidating as saying carnivore, keto, and then we, under that umbrella, we say, here are some options for you, patient, and we're not going to, and then we're going to make sure that those options exist. And that's kind of what my approach is. And then I think I had Dr. Adele Height from the Diet Doctors, and she talked about those clinical guidelines. And I know that they have a CME for clinicians where they can do it for free, which is amazing. And they incorporate the clinical guidelines. How do you do a carb restricted diet in a way that kind of fits the narrative of a community of people who are, evidence-based to the extent you can do that. And I think those are the types of things. So the research you're doing, what Verta Health is doing, what Diet Doctors are, those are the types of things we're kind of building it up so that it's not just tweets on, Twitter that we're going by. We're going by something that we can lay a foundation for. And then I think we'll get there. And that's why I'm happy that that's happening. I just want to be a part of it because we need to make sure that as many voices as possible, the soldiers on the front line, we need to stand at the front line with our guns and say, hey guys, let's go and fight this war together. So that's why. And I'm literally, I promise you, in 6 months ago, I was just in my bubble, and I kind of came out of my bubble 6 months ago, and I didn't realize you guys existed. I mean, I kind of knew. I was doing my own little tweets, but I wasn't like interacting. And then I woke up one day and said, oh my God, just like when I did obesity boards, I was like, oh my God, just imagine you write a book and you're saying reverse diabetes on your book, right? And nobody believes in that way of thinking. And then after you publish your book, you then go get obesity boards, and then you then discover, and I was so afraid that what I had written would not match what I'm learning, right? And luckily, 98% did. I think there may be a few things in there, but for the most part, it matched perfectly. And so it was I just felt like, oh my God, I finally have some like-minded individuals I'm not just in the matrix by myself anymore. And it just feels really good to be in a good place like that.
Yeah, and thankfully, and it's great to have you. That you're in this community, and the more we have, and I do think it literally is a war. I mean, I spent a lot of time in the military, and so that analogy really resonates with me. But we are fighting, and I think we need to. I don't think there's a choice. We have to. I do this for my kids, quite honestly, because I'm very concerned about how their quality of life is going to be and what their nutritional choices are going to be. Tony, are you in the Chicago area?
I am. I'm south. Actually, I'll probably be in Orland, in the south suburb, probably familiar to you because of where you lived in the south suburb. But I am at 98th and Western, so it's like the south part of the city, and they call it Beverly. So I'm there. Essentially, again, I'm more of an internist now. And of course, my website should be, I redid my website. It's just my name, drtonyhampton.com. Spell the doctor out as opposed to a DR. Obviously, the Protecting Your Nest podcast and obviously YouTube. So my big focus right now, podcast, YouTubes, just because I think people need information. And that's kind of what I'm going to try to do while helping my health system develop a weight management program and just trying to balance all of that.
And we have, in this Meet RX community, we have several thousands of members right now, and we continue to grow. And so some of them are looking for good doctors. So I assume you'd be open to seeing some of our guys if they needed a physician, right?
Like-minded patients make my life easier. Absolutely.
And do you have any plans or thoughts of doing anything remotely, like doing telemedicine stuff? Is that something you think?
You know what's funny about that? It depends on what happens with this education. And if my education that deals with the part of root cause that takes a little bit more time, doing it the right way, where you actually, talk to the patient and see what they need, I may experiment a little bit with that. We're obviously within my health system, I'm doing. I literally Tuesdays and Thursdays, I already work as a virtual doc, and then that way we can social distance at work. But so the short answer to your question is absolutely. I know there's some laws. I think when you talked to Dr. Beer about it, she said that she was in California and Illinois. She left Illinois to go to, Dr. my buddy in San Diego. But I do think that I know I just think that's a good way to do it, because most of what I have to say to people is teaching. So if I'm having a conversation like this, they pretty much can be successful just with an interaction like that. So the short answer to your question is absolutely.
I've got some barking dogs. Hang on just a second. We're right at an hour. It's such a pleasure to meet you, and what you're doing is wonderful. And I'm so glad to know that you're in the community doing this. Tell us, is there anything you want to mention that we didn't get to chat about? I want to give you an opportunity for anything else you want to, any other message.
Well, I think, it's so funny. Somebody just commented about the nest and the rope. So let me tell you why it's important to have continuous learning. Thanks, Teresa, for commenting. The nest, I had that in my head before I started my journey with functional medicine, education, and nutrition. That's nutrition, exercise, less stress, more sleep, how you think, and trauma. That's what those letters mean. The trauma came from functional medicine, and in communities of color, a lot of trauma. The rope, you got to climb the rope to get to the nest. And that's the first episode of the podcast that goes into more detail. Relationship. So if I'm in a dysfunctional relationship, I'm going to be sick. The O for organisms, the P for pollution. I always use the example of the south side of Chicago, more pollution, more asthma, more COPD because of the factories. And the E is for our emotions and our life experience. And so my point of bringing that up is to say, if you don't address the root cause of disease, which is basically all of those talking points, you will not be healthy. So rather you do low carb, intermittent fasting, paleo, and you don't get that relationship together, you're still going to be sick. So when I tell my patients, where do you have gaps? Let me help you fill gaps. One of the books I recommend to some people is called The Shack, which is more of a spiritual book, but it's not really about the spiritual part. It's about they had a loss of a family member and they're sick because of that. And so I'll say, read this book that may put that loss in perspective. So what I try to do as a doctor is what resources can I give people so they can be whole? If they're in a relationship, they got to do the 5 love languages or the principles of marriage by Gottman. Those resources are there, but if I'm not a chronic learner, I won't know about, all I'll know about is how to put you on metformin. And I have to be beyond metformin if people are going to heal. So that's the way I would wrap it up. Get to the root cause, understand what metabolic disease is and that you need to fix that. And then the healing would just magically occur. And I'm going to work on my chest so I can catch up with you.
Great message, Tony. And I think that beyond metformin is a really, really nice slogan. Thank you. I look forward one day to meeting you in person and shaking your hand when we're actually allowed to shake hands again. Hopefully that day will come.
It'll be so.
Anyway, so thank you so much for coming on. Hopefully we'll, like I said, get to chat some more with you.
We will.
All right, folks, I'm going to shut it down. We'll see you guys tomorrow. Tony, thanks again. Have a great rest of your week.
Guys, thanks for everybody that's here. Charlotte, I see you. Teresa, have a great day, guys.
All right. Bye-bye, everybody.